Greetings, friends. Please put down your pencils and put away your notebooks. Time for the Friday film. Today's film is how space exploration and the technologies discovered can push the boundaries of medical science.
Each time we send a spacecraft, a satellite, or a space probe to explore our solar system, the people on Earth reap numerous benefits derived from the research and technologies that are developed from NASA's space programs. NASA's objective, to explore outer space and relay the information back to Earth with ultra-precision, has in turn launched medical research into new areas useful to our present and future way of life. A key element in space travel is micro-miniaturization, like the circuitry in this programmable pacemaker. The operation to implant the pacemaker is no longer critical. Once it is implanted, no future operations are necessary for reprogramming or fine-tuning.
First of all, we'll turn the machine on. It's on. It tells us we have a rate of 70.
The physician can program as many as 6 different heart-stimulating functions into the pacemaker.
Of 2 millivolts, refractory period of 325 milliseconds, and no hysteresis.
The physician has changed the patient's heart rate from 70 to 75 beats per minute.
60 ohms.
The pacemaker also provides information on the electrical resistance of the wires connected to the heart. It tells how effectively the heart is being paced, warns of possible wire breaks or short circuits, and tells how much life the pacemaker has left. Once this is completed, the computer records a hard copy printout to show how all functions register. Scientists working with NASA are presently developing PIMS, the Programmable Implantable Medication System. PIMS will be especially useful to diabetics and other people who require medication on a daily basis. PIMS has a number of micro-miniaturized chips in the circuitry which are programmed to perform certain functions within the device. A highly reliable hydraulic system is controlled by the circuitry to release insulin from a reservoir and pump prescribed amounts of medication when it reads that the sugar level in the blood is beginning to rise. The programming unit in PIMS uses command telemetry systems with functions similar to those used on satellites, space probes, and manned spacecraft. Viking's stereo camera system permits us to see the Martian landscape in three-dimensional detail by mathematically quantizing the information it scans and transmitting that information to Earth. Computers read and translate the numbers into images. Dr. Samuel Berkowitz, an orthodontist in South Miami, Florida, has applied a modification of Viking's camera computer system called the optical profilometer to his research in correcting cleft palates. A cleft palate is a physical malformation which occurs during the early stages of fetal development. Otherwise, the person is normal. Fortunately, a cleft palate can be dramatically corrected by surgery during the child's infancy and preschool years. Casts are taken of the child's mouth to study the degree of malformation as the child matures and bones develop into a definite growth pattern. The optical profilometer scans each cast and computes the information to give an accurate account of the patient's growth development. In the past, corrective surgery for cleft palates was partly based on a certain amount of guesswork, relying on the surgeon's knowledge and experience. Dr. Berkowitz hopes to develop a universal data bank to clarify growth information as a concrete reference for surgeons. In his effort to apply NASA technology to his research and his close teamwork with other surgeons and doctors, Dr. Berkowitz has helped to divert the tragic psychological effects that could otherwise plague a child with such a malformation. The same image processing techniques used to transmit photos from outer space are applied to biomedical research at the Jet Propulsion Laboratory. X-rays are used to diagnose heart disease, but the exact degree of an artery's blockage is difficult to measure without using a computer. The technician projects a computer-digitized version of the coronary angiogram on the television monitor. He identifies the approximate midline of the artery as a reference to guide the computer. Once the computer has a reference point, it measures and traces the actual size of the artery. The computer searches for and identifies the obstruction inside the artery. Finally, the computer calculates the degree to which the artery is blocked, and the technician can see where and how much an accumulation of plaque is forming to block the artery's blood flow. We stand on a new threshold in medical history by using the same image processing technique that has taken us hundreds of millions of kilometers from Earth as we explore other planets and moons in our solar system. At NASA Lewis Research Center, scientists have developed a new contribution to medical technology. They have taken the principle of the ion thruster propulsion system and applied it to medical implant technology. The ion thruster is an electronic propulsion system that stabilizes satellites in orbit and propels space probes into deep space. The ion thruster is housed in an outer space simulator. It discharges ion beams at its target. The impact of the beams on the target is similar to sandblasting, but on a microscopic scale. This plastic knuckle can replace a real knuckle. Scientists have found that a metal sleeve lessens the friction between the implant and the bone. In order for the body's tissue to accept the metal implant, the surface has to have a uniform texture. These microscopic photos show the difference between a smooth, untextured surface and an ion-textured surface. The latter is compatible with and conducive to tissue growth. As researchers continue their studies of the ion thruster's non-propulsive applications, NASA's primary research continues as technicians test the thrusters for space travel. NASA is planning toward the day of manned flight in outer space that will last over a period of months or possibly years. Healthcare and emergency treatment will be conducted between the astronauts in the spacecraft and a physician on Earth by means of telemetry communication. As part of this research, astronauts on the Skylab missions conducted a number of medical activities which were recorded and monitored by physicians on Earth. Following the Skylab missions, NASA Johnson Space Center and the Indian Health Services on the Papago Indian Reservation developed a joint program known as StarPac, Space Technology Applied to Rural Papago Healthcare. The same principle and technology in conducting medical treatment in outer space by telemetry communication is applied to remote areas on Earth. Every week, StarPac's mobile health unit goes out to the reservation to provide health care to 75 villages sprinkled over 11,000 square kilometers of the Arizona desert. Approximately 10,000 people live on the reservation. Patients undergo examinations and receive health care conducted by a trained community health medic. Many kilometers, perhaps hundreds of kilometers away, at the Indian hospital in Cells, a physician monitors the examination by a two-way camera, voice, and data system. A central microwave station located on the reservation serves as a relay between the mobile health unit and the hospital base. The physician is able to control the camera while he and the medic discuss the examination. It also gives the patient a chance to talk directly to the doctor to describe a specific ailment.
Doctor, she's complaining of a pain in her stomach, but nothing seems to be abnormal.
Does she have any signs of fever or any cold symptoms?
No, and no fever, but her throat is a little inflamed.
Any sign of an ear infection?
The two-way system allows the physician to call up the patient's medical history from a central computer bank hundreds of kilometers away and display it at the hospital as well as in the mobile health unit. X-rays are displayed in the same way. The ultimate result of this sophisticated communications technology is that healthcare is available to people in remote areas, even in outer space. As we continue to reach to the stars and to the planets to gain more knowledge about our universe, and NASA continues its research in space exploration, we are constantly discovering new technologies. Technologies that enhance the quality of our lives down here on Earth.
Thank you for your kind attention. Please remember to like and subscribe for notifications of future projects.